Hello, I'm Dr. Suresh Keshan. I'm MD Pediatrics and I'm the director and promoter of the clinic La Mom at Baby. Today I'll be speaking on general child care and the things which the parents mostly have questions about when they visit to our clinic. It will not be a technical medical session, but it is just going to be an informative session which will inform the parents about the common anxieties and questions that the parents have in their mind. The first and foremost, I just want to tell all the parents that the natural love and affection that you give to your child is priceless and precious, and nothing can substitute that. Today in the digital world, there is a lot of literature available digitally also, basis which the parents they are a little bit confused as to what should be done about the child upbringing. And the main thing what they have to remember is that as long as there is love and affection of the parents for the child and the family atmosphere is loving and caring, the child care can never go wrong, and the upbringing of the child will be as per the expectations of the parents. So they don't have to do anything extra, they don't have to put anything extra efforts, they don't have to read a lot of literature as to what is the optimal child care. Rather, whatever comes naturally to them, that is actually the best child care which can happen to the child. A common problem what we find in India is regarding, I'm now talking about the pregnancy and the birth of the child. The common problem which we face is the propensity of the parents or the inclination of the parents to have a male child. Maybe it's due to the cultural factors which are present in India. Now in the modern era, the female child also is gaining acceptance in India, and that is a very good cultural mindset change which is occurring in India over the period of time. But one thing just I want to clear over here is the gender of the child, the newborn which is born, is actually is actually 100% dependent on the father, because the father is the one who passes on the chromosome, that is the Y or the X chromosome, which determines the gender of the child. So only thing what I want to clear is the mother is in no way to be held responsible for the birth of a girl or a male child. It is the father's genes or the chromosome which actually causes the birth of a male or a female child, which is that. Another common problem with the parents face is that when the child is born, they feel it's very gentle and it's very fragile and very delicate. Actually, a newborn, as has been ordained by nature, is a very strong and robust creature, and its defense mechanism very well developed. So parents need not have that anxiety in mind that a newborn is actually delicate or requires some special care or requires to be kept away from infections or to be kept in a very sterile environment. Nothing of that sort. The good hygienic practices which we all are aware of, those only have to be practiced for a newborn. Of course, the breast milk is one of the main things which is encouraged, so that the newborn baby gets the optimal nutrition from the mother's milk, as well as it also helps in the immunity of the newborn. Once the newborn is born, after that the next step which comes for the immunity of the child is actually vaccinations. It's a good thing that in India now vaccination acceptance has become very good, and the parents themselves, they come forward and ask about the various vaccines which are prevalent, and most of the parents, as per the economic budget, they want to give the best to the child and try to get the child vaccinated. Vaccine story has been a very big success worldwide, and the prevalence of the disease load which are directly related to those diseases in which vaccines are available has dropped dramatically. Even in India, we have hardly seen now cases of, let's say, measles or chicken pox or diphtheria, pertussis, tetanus, all of them all due to the remarkable success of the vaccinations. So we will definitely advise the parents to go ahead and get the child adequately vaccinated. One of the questions which parents often ask is, this is the age, like my child is 5 years of age, for example, and this vaccine was scheduled, let's say, as 2 years of age. So is it now past? Is it the time has gone by? There is nothing like a cutoff age for the vaccines. Any age you can go ahead and give the vaccine for the child. So don't worry about that thing. If you have passed the scheduled vaccination schedule, if it is passed, you can still go ahead and give the vaccination for the parents. Then I'll come to a little bit, I'll speak about the parental expectations from the child. In today's cutthroat competitive world, no doubt every parent wants that their child should be a 5-star child sort of, and should excel in academics, should excel in various extracurricular activities, and should have a very good career going ahead. So these are the parental expectations which are there, but one has to see that these expectations are realistic in nature and does not put an undue pressure on burden on the child to live up to the parents' expectation, because if this scenario occurs in that particular case, we are sort of creating children who are sort of becoming neurotic, in the sense that they are overburdened with the expectations of the parents which are there. So I'll just say I'll just guide the parents to take the things at ease and let the child develop to its optimal potential, whatever is there. You just help in that ongoing process of the child, by which the child actually develops to its optimal potential which is there. Another thing which we often face is the problem of working parents, where both the parents today are working. This causes a lot of guilt. It's mainly the guilt part in the mothers particularly, because by our Indian culture, the female is supposed to look after the home, is supposed to look after the baby and see that the upbringing of the child is good, and see to it that she is sort of physically present in the home to take care of the child. But because of the working woman culture today which is present in India, a lot of educated women are actually working, and because of that they harbor a guilt in their mind. So there is absolutely nothing to harbor a guilt about it, as long as the caretaker to whom you are leaving the child behind after you go to work is loving and caring. So that is the most important part. It may be the grandparents, it may be some caretaker which you have engaged into, it may even be, if you don't have, it may be even a creche or a nursery, whatever you want to put the child, but the child should be in a loving and affectionate environment. That is the most important thing. And studies have also shown that if the mother is working, the child is in no way hampering the mental, emotional, psychological development of the child if the mother is working. In fact, it has somehow proved in opposite sense that the children whose parents are working are in the long run more autonomous, more free, more decisive in nature. They become independent faster, and because they are not dependent on the parents for the small things, and right from the beginning, because both the parents are away, so they learn to manage the thing themselves. So that creates a sense of independence in the child. Another common problem and concern about the parents is regarding the feeding of the child. Again, it's due to so much literature being available about various nutrition and so-called nutrition experts which are there, who have their own theories and mindsets about how nutrition should go about. It's a very simple thing. For the child, whatever you give to the child which is homemade, that is the best, first of all. So the child should be very minimally dependent on outside food and packaged food. So that is definitely on. Apart from that, whatever you are preparing at home and giving to the child, that is the best nutrition for the child. Take it from me, if you give that particular thing to the child will never suffer from any sort of a malnutrition or a decrease in the so-called immunity. What the parents think will decrease the immunity of the child. The child does not at all suffer from the decrease of the immunity, does not suffer in any way from the growth of the child. So whatever is homemade you give. Regarding the balanced diet, what the parents feel this should be there, or proteins are less, or fats should be this much, or vitamins are lacking, etc., etc. In the long run, whatever we are eating at home, it is balanced. I also eat, the parents also eat the same food. We never think we are becoming imbalanced. So why should we think the same thing for the child? The food what we are giving to the child is actually causing some sort of a nutritional imbalance in the child. So once you realize this fundamental fact, you will not have that sort of an anxiety and restlessness in the mind about the feeding or what should be offered to the child actually on a day-to-day basis. Another common problem what we face in the pediatric clinics is about the mothers and the parents complaining that my child is a poor eater. So they say that the child is, we try to offer to the child, but the child simply refuses to take anything. And so they feel because of this feature, the child is not taking anything, is actually the child is starving. And because the child is starving, therefore this body weight is going down, and therefore it creates a lot of anxiety in the parents. Now, the important thing for the parents to realize is two very important things are there. First of all, it's a situation created by the parents themselves in putting the pressure on the child to eat. Why I'm saying is because if you see in the villages, for example, in the villages, the mothers they don't care about the child. Whatever the child comes, eats, his offering is there, and the child will eat, right? And there the child eats very nicely. There is no complaint from any mother of the village any time in our segment of the population or the pediatric population which we see. If we see the mothers which come from the villages, they never will come and complain that my child is not eating well. And 90% of the mothers who are living in the urban sector, who are educated, they are the ones who are complaining that my child does not eat well. The reason is that the mothers in the urban sector, they pay a lot of attention to this eating part, while in the village sector, the mothers, they let the child free. They let the child eat whatever the child wants to eat. Another example, if you want to sustain to bolster my argument, is if the same child of yours goes to a neighbor, you will see the child will eat everything over there. But when the child is at your own home, the child does not eat. So the reason only is that the pressure which is being exerted on the child makes feeding a not enjoyable event for the child, and therefore the child, because he is not enjoying it and he feels eating is a sort of a core or a task or an activity that has to be performed by him, and for which the parents are actually putting so much pressure on him, okay, so he is not enjoying it. So once you let go of this pressure and let the child enjoy the meals, then the child will automatically start eating well. Another common problem is the concept of what is a healthy weight or what is a healthy height. So most of the time the parents feel that my child is like slim, and they see other children around and they feel that the child around is well built, healthy, and all this sort. In today's world, overnutrition is a burning issue and is a major problem as compared to undernutrition, if I talk of the urban sector. So the weight of the child actually should be slim. The child should not be overweight, because if the child is overweight in the very initial stages, it will lead to obesity even later on in life. So this thing has to be taken care of by the parents, that they should not have that image in the mind that the child is actually thin or is slim. That actually is a healthy child for that matter. Then there is a range of weight. So let's say 1 year old child, anything between 8 kilos to 12 kilos is a healthy range. So don't compare my child is like 9 kilos and my neighbor's child is 12 kilos. So those comparisons are not good, because both the children are actually healthy in nature. Some common problems which the parents feel about the child, I'm speaking from the point of view of illnesses. One of the common problems which the parents come across is with fever. Fever in a child is mostly viral in nature, and therefore the use of antibiotics is not justified unless there is a reason to prescribe antibiotics for the fever. Most of the fevers, they will go away in 3 to 5 days. So that patience you have to have for 3 to 5 days for the fever to go away. And lastly, the parents, they monitor the fever and feel if the fever is 102, 103, it is dangerous or the child is becoming serious. There is nothing of that sort. fever 102, 104, 90, 100, they are all fevers. They are all fevers. There's nothing like 104 fever is more dangerous than 100 fever or 101 fever. So don't have that anxiety in mind about the intensity. Don't monitor the fever that frequently, and simple antipyretic or anti-fever medicine you can give to the child on prescription from your pediatrician, and 3 to 5 days you give for the child to recover, and 99% of the fevers, they are benign in nature and nothing happens to the child. Another problem which the parents face very often is about the crying of the child, particularly for the newborn babies and when the baby is up to 1 year of age. There are a lot of things where the baby starts crying, and the parents they don't know what to do about that particular crying. So when the baby is actually born, initially the baby's sleep pattern is more adapted to what the sleep pattern was when the baby was inside the mother. So during the pregnancy part, the mother is actually active in the daytime, and because of that activity levels in the daytime, it causes a rocking effect for the baby, and therefore the baby feels soothed and sleeps in the daytime. But in the night, the mother actually is sleeping. At that time, that rocking and soothing motion is gone, and therefore the baby tends to be awake in the mother's womb during the night time. Now this particular pattern, which is established during the pregnancy, carries on when the baby is born, and therefore it's a common thing that the baby sleeps more in the daytime and less during the night time. This pattern to come back to the adult pattern, and where the baby gets its own circadian rhythm, takes around about 3 months. So up to 3 months, it's possible that the baby is actually awakening more at night rather than in the daytime. Crying in the baby is mostly due to hunger, which the parents tend to recognize very fast. Sometimes it may be due to diapers being wet or the child having passed urine or stool, and that also the parents are able to take care. But one of the things which the parents is really stressful is what is known as infantile colic, in which the baby, particularly in the evening, goes on crying for a prolonged period of time and does not soothe. This is a benign condition, and it may take 3 to 4 months of the age before the baby actually settles down. It's a trying time for the parents, and it's stressful. I am aware of that one, but I think the best option for the parents is just to laugh it out, and it's all right for the parents to get irritable also sometimes, but yeah, it's okay. They just have to see to it this phase passes over. So that's the thing. Another question they ask about is how much sleep the baby should be getting. So the sleep, mostly in a newborn, anything between 14 to 18 hours is fine, and this reduces to around about 10 to 12 hours by the age of 2 years, and later on it becomes to 8 to 10 hours by the age of 6 years. So this is about the sleeping pattern. So I've tried to summarize whatever common problems we face when the parents come to the clinic. Purpose of this talk is to make the parents aware of the common problems which are there, and I hope you will really enjoy it and like this particular talk. Thank you.